Hi everyone, I'm Dr. Michael Richmond, a double board certified cardiothoracic surgeon. I've been asked by so many of you to talk about the peptide Cerebrolysin. Does it improve cognition, I've been asked. Does it prevent Alzheimer's? Does it prevent a stroke? So the questions go on and on. So today let's talk about what it is and what it isn't. So what it is it's a peptide mixture derived from porcine or pig brain. And it contains low molecular weight peptides and amino acids, and it's been purported to have neurotropic and neuroprotective properties. It is not administered orally, so if somebody gives it to you orally, that's not it. It's administered via an injection some way. And it's used in several countries, as many as 50, but it's not approved in the United States for neurological conditions such as stroke, dementia, and TBI, traumatic brain injury. But here's one problem. Porcine brain tissue is a known reservoir for parasites like Toxoplasma gondii, which is a protozoan, and Taeniisolium, which is a tapeworm. So, unless animals are specifically sourced, and we don't know if that's the case, and screened to be pathogen-free, the safety of these peptide products like Cerebrolysin depend on the rigor of sourcing and purification protocols. Human studies now, what are they? Well, they've investigated Cerebrolysin's efficacy in acute ischemic stroke, which means lack of blood flow, stroke, vascular dementia, and Alzheimer's. But the results are mixed and limited by methodological concerns. For acute ischemic stroke, which is the most common type of stroke, a recent high-quality comparative effectiveness study called CREGS, CREGS2, found that Cerebrolysin was superior to standard therapy for functional recovery and cognitive outcomes at 90 days. Great, with no increase in adverse events. A meta-analysis of 9 randomized trials also showed a statistically significant benefit for early neurologic improvement after a stroke with the number needed to treat of 7.7. So in other words, 7.7 people needed to be treated for one to have a benefit and a favorable safety profile. However, a 2023 Cochrane review concluded that moderate certainty evidence indicates that Cerebrolysin probably doesn't reduce all-cause death or serious adverse events in acute ischemic stroke and may increase non-fatal serious adverse events at higher doses. Now, for vascular dementia, a Cochrane review found very low quality evidence for small improvements in cognition and global function, but the clinical significance is uncertain and the risk of bias is high. Now, for Alzheimer's, randomized trials and reviews suggest that it may improve global measures and cognition, especially as adjunct or additional therapy. But the magnitude of benefit is modest, and as usual, further robust studies are needed. So I'm sure the next question is, why isn't it approved in the United States when there appears to be benefit in some of these patients? And that's a really valid question. Well, it's not approved in the United States due to insufficient high-quality, consistent evidence, demonstrated clinically meaningful efficacy in major neurologic conditions. So that's the main reason, okay? And there also are concerns about study designs, risk of bias, and lack of robust, methodologically sound clinical trials. Additionally, many studies supporting Cerebrolysin have limitations, such as unclear allocation, concealment, selective outcome reporting, in other words, they pick and choose, industry sponsorship, and lack of adequately powered trials. In other words, there's not enough people, it's not done long enough, etc. These factors contribute to the regulatory hesitancy because the FDA requires substantial evidence of effectiveness from well-controlled clinical trials, which has not been met for Cerebrolysin for the indication study. And I know many of you don't like the FDA, but the truth is, in order to get something approved, they want high-quality evidence. And rigorous studies need to be done. Otherwise, potentially dangerous stuff will be approved and has been approved. And retroactively, they identify this and it's pulled. So with that, I hope you learned something today. Thank you so much for listening. For more information, guidance, or a consultation, you can go to my website at www.paladinmds.com and have a great day. Thanks.